All right, so before we can get into anything about the cardiac system, we need to make sure that we know and we understand the anatomy of the heart. Okay, so this right here is just the anatomy of the heart. You have your right atrium, you have all your valves, you have chordae tendineae, and this is what the papillary muscle pulls back on the valves right here to open up those valves to bring blood from the atria to the ventricles. Okay, so then you also have your epicardium, which is the outer layer of the heart. You have your myocardium, myo meaning muscle, and this is where all the cardiac muscle is located. And then you have your endocardium, which is the inside of the heart right here, lining all of the ventricles. So epicardium is most superficial and endocardium is the deepest. And all of these three layers right here make up the heart wall. Then over here you have your aorta, left pulmonary artery, you have your pulmonary veins, your descending aorta, remember because the heart's 3D, the aorta is going to be pumping blood up and it's also going to be pumping blood down. Your inferior vena cava, superior vena cava, right pulmonary arteries. And so once we understand this, now we can go into understanding the pulmonary circuits and the systemic circuits. Okay, so the pulmonary circuit is going to work with bringing deoxygenated blood from the body to the heart, to the lungs, then get oxygenated in the lungs, then go from lungs back to the heart, back out, and back to oxygenate the body. All right, so let's walk through the exact pathway of how it's going to do that. First thing is you start and you do capillary exchange in the body. And that causes the blood to then become deoxygenated. So it needs to get reoxygenated again so it can then give the body the proper oxygen that it needs. So right here, it's a deoxygenated. This is the pulmonary circuit. The pulmonary circuit is going to bring this deoxygenated blood through the superior vena cava or the inferior vena cava, and it's going to collect in the right atrium right here. Then it's going to go from the right atrium through the tricuspid valve into the right ventricle. Then it's going to pump from the right ventricle out the pulmonary artery, through the pulmonary trunk, through pulmonary arteries to the lungs. And this is where oxygen exchange will happen and the blood will now become oxygenated. So now we're in the systemic circuit. And the systemic circuit's job is to bring oxygenated blood back to the heart and to the body. So it goes from the lungs through pulmonary veins, which are going to be here, and they're also going to be here because the heart is 3D. This is just a 2D picture. And it all collects in the left atrium. Then it goes through the mitral/bicuspid valve right here, collects in the left ventricle. Then it is pumped through the aortic valve, which is this little dot right here. And it goes through the aorta or down through the aorta, around, and then it oxygenates the body. So that is the pathway of blood flow through the pulmonary and the systemic circuits. Again, the pulmonary circuit's job is to bring deoxygenated blood to the heart, to the lungs, and then the systemic circuit's job is to bring oxygenated blood from the lungs to the heart, to the body. One more thing I want to note is that in the heart, the tricuspid and the mitral/bicuspid valves are known as atrioventricular valves because they're between the atrias and the ventricles. The pulmonary valve and the aortic valves are called semilunar valves, the two of them. So those valves are semilunar valves.